Research shows the rate of teenage vaping has doubled in the last couple of years. E-cigarettes have led to hundreds of hospitalizations because of lung issues and possibly have linked to at least 7 deaths across the country, including one here in Kansas. In this week's edition of Your Health Matters, 41 Action News anchor Lindsay Shively spoke to a local doctor about why we all need to be concerned.
While those investigations continue into what is causing those deaths and serious illnesses related to vaping with e-cigarettes like these, we're left to wonder, why is this happening? So we are here with Dr. Eric Peters at Overland Park Regional Medical Center's Pediatric Critical Care Unit. I wanted to start with asking, is it really safe to inhale anything to a point, doctor?
Well, in general, no. If you've ever inhaled pepper, you know that to be true. But so much of the lungs' immune system and the body's protection for our lungs is located from the neck up. We cough, we sneeze, our nose filters particles, we have a cough and a gag and an active other measures that keep things out of our lungs. When you inhale something in, you bypass 90% of the protections for the lung. Well, a lot of the commercial products, you do know what's in them, and they can at sometimes have a very high content of nicotine, which is fueling a whole nother generation of nicotine addiction. But beyond that, there's lots of off-the-street products, and kids are adding their own methods to this by adding THC, by putting the oils directly on the heating element to get a bigger nicotine dose. So there's a lot. Even though you know what's in the cartridge, that's not necessarily what's going into your lungs with these other methods.
Are you surprised from the medical standpoint that, we talked about not knowing what the long-term effects might be for some of this, but now we're faced with short-term issues now?
Correct. As short as a year ago, we were concerned, what is this going to do to our kids long-term? Is this the same as smoking? And now, as the illnesses pile up, as the deaths are starting to present, we're much more concerned about the acute effects, and that may be much more dangerous than we ever thought.
Dr. Peters, thank you.
Thank you.
That's anchor Lindsay Shively there reporting. Symptoms of the vape-related lung diseases are coughing, chest pain, shortness of breath, fatigue, even vomiting. No single vaping device, ingredient, or additive has been linked to that disease, but most patients said they vaped products containing THC, the high-producing part of marijuana.